hospital operating room. There are separate locations where the patients come in. We do there's a nursing evaluation and follow our timeout procedure. The surgeon meets briefly with the patient before surgery. And then they're brought down here, past our main OR area here. And we have sort of everything run off the hospital's computer system. Doing my surgery here, I'm going to go past that yellow line, dressed in sterile attire, which you see Dave, one of our CRNAs, dressed in. And we go into the different operating rooms. So for a patient undergoing a craniotomy for a brain tumor, all of the typical protocols for any surgery are going to be followed, including, of course, the perioperative checklist. Specifically for craniotomies, that's going to be quite an involved process. We need to make sure that the anesthesiologist at sort of the top of the table is fully aware of medications that I need administered prior to the surgery, which are going to include not just antibiotics, but specialized medicine. Other members of the operating team are going to include the scrub nurse, who is gowned and gloved and sterile, who's directly handing instruments and working with me and my assistant, and then a non-sterile or circulating nurse who can run and get equipment, open it, and do things like that. For operations, I'm going to be assisted either by another surgeon for some of my spine operations, or in this case I was assisted by my physician's assistant, who's trained to sort of assist with neurosurgical cases. So we usually have a team of at least 2 people kind of actually doing the surgical part. In this particular room, in addition to the anesthesia machines, you see we might be moving in an operating microscope. We have some image guidance for certain types of tumors where we can kind of see our location in the brain on a computer screen. And there's sort of a whole host of other equipment that we might use. For this particular tumor, there was it's such a very, very large tumor. We actually have a sort of an ultrasonic aspirator that's very commonly used for brain tumors, which actually sort of vibrates and shakes apart the tumor's tissue and then vacuums it up at the same time. And that's a really, really helpful piece of equipment for the types of large brain tumors which this patient had. After the surgery, the anesthesiologist is going to reverse the anesthesia and wake the patient up, and then there's going to be that monitoring period and then the ICU period, and that's going to be very critical again for a patient with a brain tumor where postoperative seizures, bleeding, other issues can all occur. In Ms. Collier's case, we were particularly concerned because we had received information ahead of time, this possibility that the tumor might be malignant. We were very concerned about brain swelling. So it was definitely tense, a very intense case. And even though technically it went very well, there's sort of nothing better than seeing her in the recovery room, waking up and starting to respond to us and moving her arms and legs and kind of having that visualization and knowing that neurologically her brain was recovering and she was doing okay.